Hi, I'm Laura Heelan. I'm in the Teaching Fellows program majoring in special ed. First, I'll be reviewing from the course textbook, Exceptional Lives, Chapter 13, Students with Multiple Disabilities and Traumatic Brain Injury. Multiple disabilities means the student has two or more disabilities occurring at the same time in which educational needs require more than one disability to be addressed. Disabilities can be categorized into the 5 domains: intellectual and academic functioning, adaptive skills, motor development, sensory functioning, and communication skills. Multiple disabilities can be identified by parents and doctors when they notice delayed developmental milestones as a baby and medical complications. Non-discriminatory evaluations include genetic testing, physical exams, and individualized intelligence tests. Next, I'll be discussing traumatic brain injuries. A TBI is an acquired injury to the brain caused by an external physical force. Characteristics of a TBI are similar to learning disabilities, communication disorders, emotional or behavioral disorders, intellectual disability, and other health impairments. The identification of TBI includes a CT scan, MRI, neurological exam, and special ed referral, which includes individualized intelligence and achievement tests. Non-discriminatory evaluations include adaptive behavior scales, cognitive processing tests, and behavioral change. So how can we promote inclusive environments? Paraprofessionals can help include students with multiple disabilities into the general ed classrooms. They're classroom aides who support the teacher and provide one-on-one support or small group assistance. I'm a parapro at Tempe High, and I give extra support to students in a small group setting. A way to include TBI students is by teaching peers to be respectful and encourage positive behavior, building relationships with their peers, and participating in peer tutoring. Person-centered planning is a teaching practice that can benefit students with disabilities. It puts the student and their family at the center of education support, which is something we should always be doing. Some ways this can be incorporated are aligning special ed services with the student's long-term goals, inclusion, providing choice, building relationships, and fostering leadership. Now I'll be reviewing Chapter 14, Students with Physical Disabilities and Other Health Impairments. First, I'll be discussing physical disabilities. A physical disability is a severe orthopedic impairment that adversely affects educational performance. The two most common physical disabilities are cerebral palsy and spina bifida. Characteristics of cerebral palsy are motor difficulties and limited control that impact balance, posture, and gait. Characteristics of spina bifida is damage to spinal cord during the first month of gestation. After birth, there is mobility and sensory loss. To identify physical disabilities, there will be difficulty with moving, fine motor skills, daily living activities, and posture. Two screenings are developmental assessment and functional assessment, and numerous non-discriminatory evaluations. Next, I'll be discussing other health impairments, specifically epilepsy and asthma. First, I'll go over epilepsy. Epilepsy is recurring and unprovoked seizures that are similar to an electrical storm in the brain. Some seizures can affect one side of the body, loss of consciousness, or no memory of the seizure. Next, I'll review asthma. Asthma is a chronic lung condition characterized by airway obstruction and inflammation of the bronchial tubes. Asthma's characteristics are asthma attacks that cause shortness of breath, wheezing, coughing. Severe attacks can interfere with physical activity. Other health impairments can be identified by an abnormal physical and medical test. Some teaching practices include assistive technology, self-monitoring, having students serve as scribes for a peer, writing in the 504 plan to allow assistive technology, and that the student should be given breaks. A strategy is positive interdependence, which is when students have to work together to exceed. Each member has a specific task based on their ability level, but each task is important for the complete goal. In summary, no matter the type of disability, we must remember to be inclusive of all students. We can use various teaching practices to promote inclusive environments. As educators, we must be well educated on these disabilities and how best we can serve our students by knowing their needs. Thank you for watching.